Good evening all. So today we are going to learn about Glasgow Coma Scale. So as we all know, what is Glasgow Coma Scale is a neurological tool that assesses the consciousness level of our brain, so that if any brain injury occurs or if anything goes wrong with our brain, we will get to know what is how much the injury has occurred in the brain. So basically, if the injury is mild or moderate or severe, so the assessment tool for that is our GCS scale. So we use that GCS scale to assess the brain injury. So that is the main purpose of GCS scale. So in GCS scale, what we are going to what three things we are going to look. There are three parameters that we look into the GCS scale. So first GCS, in that the first is eye response, then second is your verbal response, and third one is your motor response. There are three things that we look after the GCS in the GCS. So basically, in short, if we are going to call it as EVM. Okay. So when the doctor, जब भी पेशेंट कभी आ जाता है इमरजेंसी में और कभी भी कोई पेशेंट आरटीए लेके आता है या फिर कुछ हो जाता है, तब हम लोग पेशेंट को हमेशा उसका GCS स्केल ही कैलकुलेट करते हैं to assess whether the patient has gone through any brain injury or not. So basically, if there is a mild injury, so in that mild injury comes under the score of 12, 13 to 15. And then moderate injury, if there is a moderate brain injury, then it comes under the score of 9 to 12. And if it is a severe injury, then it comes under the score of 3 to 8. So basically, 3 is the lowest score, 3 is the lowest score, and 15 is the highest score of the GCS scale. Okay, I hope till now you all have got it. Okay, so now let's moving forward. I just want you all to know that what is GCS scale and how it works. As I told you earlier, there is actually there is actually this thing. There is EVM. There is eye response, verbal response, and motor response. So basically, there are markings for it. So in eye response, as you can see downstairs, the lowest score for the eye response is none, whereas highest response is 4. And then for verbal response, it is like the lowest response is 1 and the highest response is 5. 5 is, I'll explain you what is the highest and lowest response then after at the end of this video. And in the motor response, there is 1 is the lowest and 5 is the highest score. So basically, 6 is the highest score in the motor response. Okay, so now we are going to learn about the severity and what is there in it. Okay, so basically in scoring we will see that total score is 15. In that lowest score, I already told you there is 3 lowest score. So in mild injury, as we have seen already, there is a mild injury, moderate injury, and severe injury. And now the key standards are it is a standardized assessment. GCS is a standardized assessment, and it is a traumatic brain injury also. So in traumatic brain injury also we look for the GCS, and it is a standardized, like doesn't matter wherever you go, Africa, Russia, wherever you go, you will find GCS scale same as it is. So there is no going to be a difference between like the Russia is measuring consciousness level with a different thing, or India is measuring conscious level with a difference. No, it's universal. What, as I said you, it's universal. Okay, I hope this is clear till now. Then we will see it later on. Then we will move forward. It's moving forward to it. So now I'll explain you what is GCS scale. GCS scale is, there is eye response, verbal response, and motor response, as I told you earlier. Okay. Then in eye opening, if there is a spontaneous eye opening, you are going to give you 4 marking. If you are calling a patient, then you are telling them that like keep patient name, and only to that names or that sounds the patient is responding, then you are going to give 3 score. To pressure, if you are giving any pressure to the eyes or you are just touching the eyes, then you are going to give it as 2. And then if it is none, if the patient is not responding to pain, pressure, anything, then you are going to give as none, that means 1 score. Okay, that to verbal response there will be oriented. So if you're going to ask any question and patient is responding to that question properly and nicely, that means the patient is oriented. And then if the patient is confused, then if you are going to ask the patient that what is your name, and patient like the response telling his name of the village or name of the wife, so that is the patient is confused at that moment. So if you're asking something and patient is telling you the answer is only in words, that too like, so that time you can give 3 score to the patient. And if you're asking any question to the patient and only patient is giving answers in sounds, only apprehensive sounds are there and nothing more than that, then that the time you can give 2 score. And if it is like the patient is having like no response, then you can give it as one scoring as an verbal response. Then come to the last, motor response. In motor response, patient obeys the command. If it is a localized pain is there, then you are going to give 5 scoring. If not, if you're pinching the patient and normal flexion of the hand or leg is there, then you are going to give it as a 4 scoring. And if abnormal flexion is there, then you are going to give it as a 3 scoring. And if you're giving any kind of pain, or if the patient is responding it in an extension as like hand and leg extension, then you are going to score it as 2. And if there will be no response to the pain, or any kind of voices or any response of the motor things, then you are going to score it as 1. Thank you so much for watching this video, and come and wait for the part 2. We are going to come with the new topic tomorrow. Thank you so much. Thank you so much everyone. Thank you guys.